Good morning, good afternoon, good evening, wherever you are listening. My name is Roswith Roth. I am professor of psychology at the University of Graz in Austria. I would like to tell you something about the right to health reports in emotional helplines in the times of Corona in Austria. As human beings, our health and the health of those we care about is a matter of daily concern. Regardless of our age, gender, socioeconomic or ethnic background, we consider our health to be our most basic and essential asset. Ill health, on the other hand, can keep us from going to school, to work, from attending to our family responsibilities, or from participating fully in the activities of our community. By the same token, we are willing to make many sacrifices if only that would guarantee us and our families a longer and healthier life. In short, when we talk about well-being, health is often that we have in mind. The right to health is a fundamental part of our human rights and of our understanding of life in dignity. The right to the enjoyment of the highest attainable standard of physical and mental health, to give it its full name, is now not new. Internationally, it was first articulated in the 1946 Constitution of the World Health Organization, whose preamble defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The preamble further states that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic or social condition. The 1948 Universal Declaration of Human Rights also mentioned health as a part of the right to an adequate standard of living, Article 25. The right to health was again recognized as a human right in the 1966 International Covenant on Economic, Social and Cultural Rights. Since then, other international human rights treaties have recognized or referred to the right to health or to elements of it, such as the right to medical care. The right to health is relevant to all states. Every state has ratified at least one international human rights treaty recognizing the right to health. Moreover, states have committed themselves to protecting this right through international declaration, domestic legislation, and policies, and the international conferences. In recent years, increasing attention has been paid to the right to health, attainable standards of health, for instance, by human rights treaty, monitoring bodies, by WHO and by the Commission on Human Rights, now replaced by the Human Rights Council, which in 2002 created the mandate of Special Rapporteur on the right of everyone to the highest attainable standard of physical and mental health. These initiatives have helped clarify the nature of the right to health and how it can be achieved. I would like to mention some measures. Means to assure the right to health are emergency numbers and hotlines. The emergency number can be called free of charge from any phone in Austria, and European emergency numbers from any EU country. The European 112 emergency number can also be called from locked mobile phones without needing to enter a PIN. Helplines for social matters comprise different specialized and general hotlines. For example, hotline for missing children, hotline for crime victims, non-emergency medical assistance, counsel on wire for children and youngsters, and emotional support helpline. The differences between emergency numbers and helplines for social matters. Emergency numbers are reachable 24 hours in 7 days, helplines 8 hours in 7 days. To report or ask COVID-19 questions, the Austrian Health Hotline 1450 was in charge. Today, the Ö3, it's a specific Austrian radio station, emotional helpline is a cooperation between the Austrian radio station and the Austrian Red Cross. 1983, the Ö3 Emotional Support Helpline was founded as a joint campaign by the Austrian radio station, charity, and the Ministry of Social Affairs. First and foremost, graduates provided telephone service as a part of the academics training, a kind of internship in the Ministry of Social Affairs. 1997, the labor market service was discontinuing the academic training. The Ö3 Emotional Support Helpline was about to end. 1998, the Austrian Federal Association for Psychotherapy was willing to take over. It raised the level of awareness of psychotherapy in Austria. Consolation had advised in all situations for 39 years. Since 1983 has been the offer of the Ö3 Emotional Support Helpline to callers from all over Austria. If you dial the short number 116123, you can reach one of the approximately 100 voluntary counselors who are trained and organized by the Red Cross. Every year, the volunteers make more than 15,000 phone calls. Who is involved? In Austria, 4 provinces take care of the emotional support lines: Styria, Vienna, Tyrol, and Lower Austria. In Styria, 34 individuals are working voluntarily and unpaid on the support line. Each member gets a training how to handle telephone support and counseling. Every 4th day, Styria is on duty for the support line. The COVID-19 pandemic, also Corona pandemic or Corona crisis, is the worldwide outbreak of the infectious disease COVID-19. The pandemic is having dramatic effects in many countries. On December 31, 2019, an outbreak of new pneumonia of unknown cause was confirmed in Wuhan, China. On February 11, 2020, the World Health Organization proposed the name COVID-19 for the infectious disease. On March 11, 2020, the WHO officially declared the previous epidemic a global pandemic. The disease is caused by an infection with the previously unknown coronavirus virus SARS-CoV-2. In many countries around the world, there were massive cuts in everyday life during the course of the pandemic. The overall societal impact of the COVID-19 pandemic also includes the ongoing economic crisis. The coronavirus crisis has completely changed the social life in Austria, and not only in Austria. Many people feel loneliness, fears, and tension. In this situation, which is psychologically very stressful for many people, fears can be reduced and confidence can be supported in a personal conversation. These are offered by the helpline: empathetic, active listening, clarifying, encouraging a conversation, interested in problems and worries, helping people help themselves, contact and transfer to specialists. It should be stressed that talks on the emotional helplines are not psychotherapy. It is not a continuous talk over weeks and months. We can discuss and suggest a plan for the following hours or the next day, but these are short-term solutions just for the moment. The clients, even if they call several times, some are calling each day, cannot be sure that they are talking with the same counselor. And the counselors, even if they talk several times with the same caller, sometimes are weak between the talks, have to react to the current mood and questions of the caller. Data are available since 2009. We can see a sharp increase of calls between 2009 and 2011, a plateau 2012 to 2016, steady increase between 2017 and 2020. Many calls 2019 and 2020 because of Corona, but we see in 2021 a decrease. When we are looking at the calls 2020, most calls are in March, April, and May. You can call it a Corona peak. More calls came from women than men, and the total calls in 2020 were about 20,000. When we are looking at the calls 2020 and the ages, the same numbers of men and women are calling in the age group 20 to 24 and 30 to 34. More men called in the age group 35 to 39. In other age groups, more women were calling. We have two different distributions. The men who are calling are on average younger than the women, and most calls came from people between 55 to 59 years. The calls in 2021, most calls came in January, November, and December. We see also a peak in April. More calls from women, and the total calls in 2021 were a little bit over 16,000. The age groups ages between 30 to 34 and 54 to 59, about the same count of women and men called. In age groups 25 to 29 and 40 to 44, more men were calling. In other age groups, more women were calling. Most calls came from people between 50 and 64 years of age. The estimation of the importance of Corona increased between 2020 and 21. Women give Corona more importance than men, but in total, most calls don't deal with Corona in this hotline. Which themes and categories are discussed in these support calls? We built two main categories: contents of daily life and contents dealing with ill health. The daily life categories are loneliness, partnership, relationship, family, sexuality, friends, acquaintances, working, job, other issues, parents, upbringing, finance, education, school, apprenticeship, and information. The categories of ill health are illness, psychiatric disorders, mental suffering, either other depression or fear, force, violence, drugs addiction, sexual abuse, and legal issues, and social issues, and suicide. Looking at the themes, the highest meant 2020, the highest themes or mentions is loneliness. Another highly documented category is other issues. That means some categories are missing. For example, anger, aggression, politics, diseases, and many callers have legal guardians and are living in public homes and have not so much money. This about 80 to 90 euro per week, or because many counselors of the hotline are not psychologists, they are unsure about categories. Many calls also deal with psychiatric diseases and other mental diseases and depression, and we cannot diagnose these psychiatric diseases. In all themes, women report more issues. The only exception is sexuality. This theme is extremely important for men. Also in 2021, the most mentioned theme is loneliness. The other important issues are dealing with illness, psychiatric disorder, and mental suffering. The gender differences are also obvious. In all aspects, women report more problems. The exception is, again, sexuality. To sum up, several topics often arose in each conversation. The topics and themes were derived from the categories in the minutes. The category other is ticked quite often. For example, some topics are missing in the category system or cannot be assigned. At the beginning of the data collection in 2009, more men called than women. This soon changed and is now fairly constant. 2/3 women, 1/3 men. The themes are different in relation to gender. Men talk more often about sexual issues, women more often about loneliness, family, relationship, anxiety, and depression. Corona is not an issue for all callers. Many people live very isolated. They are bored about the news, all about Corona and war, but some of the young people are quite over-anxious. Another issue is the war in Ukraine. Older people recall their war trauma of World War II and of the wars in Yugoslavia in the Balkans between 1990 and 1999. Generally speaking, the Ö3 emotional support lines are important measures to support the right to health. Thank you for your attention.